Hello, everyone. I can see fair few people joining in now. It's good to see you all. Will, how you going, mate? See a couple of familiar names in there. Jace, how you going? Lorraine, how are you? Good. I'll just give this another 30 seconds for a few more people to attend, and then I will start ripping in. I'll mention just off the bat, this presentation will be recorded, so you should receive a link. I'm not sure if it's immediately after the presentation, but sometime after, once it's all uploaded, so you will receive a link to view this later on. Okay, looks like we've got a fair few in there now, so I might just crack on. All right, hello everyone. My name is Jason King. I'm an exercise physiologist here at Advanced Rehab Centre, and I'm going to be presenting to you today on the need for sleep. I'm going to do my best to make the topic of sleep interesting. I'm going to be talking primarily around the need for sleep in our neurological population. If you have any questions throughout the presentation, you should have the option there to please just punch away, type away. Probably what I'll do is address all those questions at the end of the presentation, as I'm not great at dual tasking. So if anything pops up, please type away and then I'll address it at the end, or I might even cover it during the presentation as well. And after the fact, if you've got any questions for me specifically, you can email me at jason@archealth.com.au, and I'd love to get your questions throughout or afterwards as well. So before I start my presentation, I want to, let you guys know about this medical breakthrough that is a fairly recent discovery, although it's been around for a long time. So scientists have discovered a revolutionary new treatment that makes you live longer. It enhances your sleep, it enhances your memory, it makes you more creative, it makes you look more attractive, it keeps you slim and lowers your food cravings, protects you from cancer and dementia, it wards off colds and the flu, it lowers your risk of heart attack, stroke, and diabetes. You'll feel happier, less depressed, and less anxious. Now, if that was a drug, you would pay good money for that. And of course, I'm talking about sleep, and it is free. Hard to obtain sometimes, but it is free. Now, I know I've kind of exaggerated and I've given you the sales pitch sort of approach to what sleep is about and what it can do, but everything I mentioned there is backed by evidence and is backed by research. So all those positive attributes that come with sleep are true, and I'm going to do my best to kind of unpack some of those today. So the learning objectives, I'm going to hopefully at the end of this presentation, hopefully you'll understand the sleep disorders that are common with neurological conditions. We're going to talk about the magic of sleep, and then the flip side of that, the negative impact of sleep deprivation over a short and long-term periods. And then we're going to talk about the light at the end of the tunnel, the treatment for those sleep disorders, and then some sort of sleep hygiene tips as well. So essentially, I'm going to be talking about what, why, and how. That's how this presentation is going to be split up. So what being the sort of what could be going on with your sleep, why it's important that we address it, and then how we address it and what we can do to treat it. And at the end of the day, if you forget everything else, what I want you to walk away with is a new outlook that you should be prioritizing your sleep. This has really just come from, from a rehab perspective as an exercise physiologist. It's a question that I used to ask, early in my career, and people would say, oh, it's okay, 4 or 5 hours a night, and then I would move on. But, as I've done more research, not only for this presentation, but over the last few years, I realized how impactful sleep or poor sleep can be, not only on your day-to-day life, but on your rehab regime as well. So I want to know now, are you actually, operating at your 100% capacity for our rehab session? And what can we do about that to get you, feeling better? And we'll go through all those different benefits of getting, prioritizing your sleep later on. So the main sort of conditions that I'm going to be talking about more specifically are Parkinson's, MS, and stroke. And this is primarily because these are conditions we see a lot here at Advanced Rehab Centre, and there is a lot of research around sleep disorders with these conditions. Hopefully what I talk about will be relevant to you, even if you don't fall into one of these categories. So just quickly, Parkinson's. So at least 10% of patients with advanced Parkinson's rate sleep problems as their most bothersome symptom. In regards to MS, 51.5% of people with MS have moderate to severe sleep issues. And with stroke, it's a similar stat. So about 50% of post-stroke patients suffer from poor sleep. Interestingly, on stroke, sleep disturbances are both a stroke risk factor and are worsened by stroke. So it can actually lead to can be a contributing factor to your first stroke, and it actually can, and then it will impact your sleep negatively post-stroke as well. So it's quite an important one for that population. The common sleep disorders I will be going through are insomnia, which is common in all three of those conditions. REM behavior sleep disorder, very common in Parkinson's. Restless leg syndrome, common in MS. And sleep distorted breathing, which is common in all conditions. So I'll be kind of honing in on those four main conditions. Bear with me for the first half of this presentation. I'm hoping it's not too dry, but I'm going to go through those conditions and talk about sort of the mechanisms and the stats around that. And then we're going to get into the juicy stuff in terms of why we need to prioritize our sleep. So insomnia is difficulty falling asleep or staying asleep. And the diagnosis of insomnia requires at least one associated daytime functional impairment. And that could be fatigue, daytime sleepiness, irritability, memory issues, concentration issues, anything like that. So we know there's many different types of insomnia, and it can be caused by all these different reasons. So we'll go through that in a second. Insomnia and Parkinson's disease. So 37% of people with Parkinson's suffer from or are diagnosed with insomnia. So there would be quite a lot more probably going undiagnosed. In terms of the mechanisms that cause this insomnia with Parkinson's, medications can have a big impact. So dopamine agonists have a sedative effect, increases daytime sleepiness, therefore can increase or impact on your poor sleep at night. Pain is an obvious issue. Nocturia, so that's that waking frequently throughout the night to urinate. Other sleep disorders, which we'll talk about, so your restless leg syndrome, REM behavior sleep disorder, those things. Psychiatric issues, so depression, anxiety, panic attacks, things like that. And then you've got your kind of common issues that you're probably feeling would, attribute mainly to that issue with sleep. And that's our motor symptoms associated with Parkinson's. So rigidity, tremor, dystonia, all of these things will impact on your comfort and your ability to mobilize in bed. So that could be a main issue or a main sticking point for you trying to get to sleep and stay asleep for longer. Just quickly on Parkinson's and insomnia, I'm going to sort of quickly talk about the sleep patterns and the different sleep stages we go through. It's quite interesting if you go through in detail about sort of what each of these stages give you and what their different roles are, because they do have different roles. I'm not going to bore you with it today, but if you are interested, let me know, because it is quite interesting. I find it interesting. So you essentially have your non-REM sleep, so your non-rapid eye movement sleep, which is your shallow stages of sleep, for want of a better term. We have stages 1, 2, and 3, and then you have your deep REM sleep. So your non-REM sleep is in charge of not challenging, but improving your working memory, verbal fluency, motor learning, and word retrieval. And your deep sleep, your REM sleep, is therefore your long-term memory consolidation, impacts on your mood, emotional processing, and brain development. So you can see here quickly, if we look at our healthy adult sleep pattern, we gradually step down into those deeper stages, and we have a couple of times throughout the night where you're waking up, but then progressively longer REM sleep as the night goes on. Compare that to our Parkinson's disease patient, absolutely a dog's breakfast. So there's lots of waking up throughout the night. There's very little consistent sleep, regardless of the stages. And there's very little REM sleep as well. There's, you can see really only a few stages there throughout the night in this example where they're getting that REM sleep. So now knowing what those different stages do for you, you can start to have a think about what that could be impacting on through your day-to-day life. Insomnia and stroke. So Balin and colleagues found that 50% of people with stroke suffer from insomnia. Mechanisms for that, they think of primarily due to the environmental factors post-stroke and other comorbidities such as depression and anxiety. Interestingly, there's some stroke location impacts as well. So the left hemispheric stroke have trouble with their non-REM sleep, and right hemispheric strokes tend to have more problem with their REM sleep, their deep sleep, interestingly. And then post-stroke medication can have an impact as well. So if you're worried about that, then I'll be encouraging you to speak to your GP. And then lastly, insomnia and MS, very similar stats. 50% of people with MS will suffer from insomnia, or are diagnosed, I should say. So that number is probably a lot higher, given that a lot of people are going undiagnosed. Mechanisms are similar to that of Parkinson's and similar to those that are neurological disease free, I should say. So there could be other comorbid sleep disorders. There's potentially some abnormalities in melatonin production, pain and discomfort, nocturia again, somatic and cognitive anxiety. And just so you know, somatic anxiety is that physical manifestation of anxiety. So abdominal pain, fatigue, dizziness, those sorts of things. And depression as well could be a contributing factor to that loss of sleep. So a little bit of the dark stuff and the scary stuff. Now let's look at how we can treat insomnia as a condition. So the first thing we have to look at, is there an underlying cause? Is there another sleep disorder that's leading to this insomnia, sleep apnea, restless leg syndrome, etc.? Exercise. I'm going to be pushing for exercise today. So we know that exercise improves your sleep consolidation and improves your motor symptoms, therefore potentially impacting on your sleep. We know that sleep relaxation techniques such as meditation or progressive muscle relaxation have been proven to be beneficial. So progressive muscle relaxation is where you take those deep breaths in, thinking about relaxing one body part at a time. So right foot working way up the body, and those nice slow controlled out breaths or exhales. In terms of Parkinson's specific treatment for insomnia, we can have a look at the medication and the timing of that. So potentially some slow release dopamine could be helpful in terms of your mobility in bed. Satin sheets and bed rails to improve your bed mobility, and there's some growing evidence for light therapy as well. And then in terms of stroke specific, the evidence is saying that cognitive behavior therapy has shown preliminary efficacy as a treatment for post-stroke insomnia. So a couple of sort of specific things to look at there. Hopefully I'm not going too fast, guys. I'm firing away here. I will just check the chat box and make sure everyone can hear me. Good, that's okay. Nothing issues there. Cool. Okay, we carry on. REM behavior sleep disorder. So RBD is what this is referred to, and that is that loss of atonia, otherwise known as paralysis, that normally occurs during REM sleep. Stops us from acting out our dreams and literally paralyzes us when we're in that sleep state. So it is associated with that sleep enactment behavior. Very common in Parkinson's. So 43% of people with Parkinson's do report some level of RBD. And then let's look at the mechanisms and the mechanisms first. So it's a similar sort of mechanism to the damage that happens with Parkinson's. So regions of the brainstem that are responsible for preventing that movement during REM sleep are damaged in the early changes in Parkinson's. Unfortunately, presence of RBD are associated with more severe clinical manifestations of Parkinson's. And quite interestingly, REM behavior sleep disorder is being investigated as a prodromal feature of Parkinson's and Parkinson's plus. Schenk and colleagues studied 44 individuals with RBD and no neurological condition. After 11 years, that 44% of those people developed a neurological condition, and after 15 years, that number rose to 82% of people who developed a neurological condition, with Parkinson's being the most common. So they're investigating this kind of as an early marker of potential neuroprotective etiology as well. How do we treat REM behavior sleep disorder? First of all, we stay safe. So removing sharp objects, potential weapons, glass, things like that from the bed. And if it's really severe, then you can look at padded rails and moving the bed, moving your mattress to the floor, which obviously poses its other issues as well. And then there's some pharmacological treatments as well. So clonazepam and melatonin can restore some of that desired paralysis. Again, I'm not going to be pushing the medication side of things too much. I would encourage you, obviously it's case-by-case basis, so I'd be encouraging you to speak to your GP if you do have issues with that, or if you feel like that's something you need to look at. We're blazing through here. So our third condition we're going to touch on is restless leg syndrome, which is really common in MS. So restless leg syndrome is defined as an urge to move the legs, usually accompanied by uncomfortable and unpleasant sensations in the legs. So 33% of people with MS suffer from restless leg syndrome. Mechanisms include that increased nitric oxide synthesis, iron retention could be an issue as well, decreased dopamine, and the demyelination that comes with MS as well. How do we treat it? So we treat the underlying condition if there is one. So iron deficiency is an example. Exercise, again, I'm going to be pushing any study that pushes exercise because we're getting two birds, one stone with that, or more than two birds. So in 2006, a study looked at 23 people with restless leg syndrome. They gave them aerobic exercise and lower body resistance training 3 times a week for 12 weeks, and they significantly reduced their restless leg syndrome symptoms after that. There's some growing, it's limited studies, but some growing evidence for yoga, stretching, and massage. And again, medication can be helpful as well. Hopefully still with me. I'm going through this quite quickly, but I will hopefully slow down the important stuff, the more important stuff afterwards. Last condition I'm going to drill down on is sleep-disturbed breathing. So that's our sleep apnea. There's obstructive and central sleep apnea. I'm not going to go into the pathophysiology of why that happens, but essentially it's that narrowing upper airway or collapsible upper airway issues and a few other issues that could be associated as well. Very common in MS. It's common in all other conditions as well, but MS is quite common. So 46% of people with MS suffer from some sleep-disturbed breathing. And this is quite interesting because the mechanisms are actually bidirectional. So MS influences sleep-disturbed breathing, can increase it and make it worse, and sleep-disturbed breathing makes MS worse as well, unfortunately. So lesions in terms of MS influencing SDB, sleep-disturbed breathing. Lesions of the brainstem may influence components of that central breathing control. So if we have demyelination and issues with connectivity there, that can impact on that general sort of breathing cycle. And then in terms of the sequence the other way, the pro-inflammatory state caused by sleep-disturbed breathing can impact the inflammatory response with MS. So that can contribute to relapses or disease progression as well. So it's really something we want to get on top of because it actually could be impacting on your MS primarily. Sleep-disturbed breathing in Parkinson's studies are kind of wild here. Some studies were showing 15% of people, some we're getting responses of 76% of people. So take that kind of with a grain of salt, maybe split the difference. And this is compared to 0.5% of the healthy population, by the way. So we go back here, 46% of people with MS compared to 0.5% of the healthy population, 15 to 76% of Parkinson's. And then with stroke, those with mild to moderate sleep-disturbed breathing, about 70% of people with stroke, and those with severe sleep-disturbed breathing, 33%. So quite high numbers there, even with stroke as well. How do we treat it? Get your sleep apnea mask and wear it. It's not enough just to get it. We need to be compliant with it as well. And I'll give you a pretty gripping stat to go with that. So this study looked at the long-term impacts of people that had sleep apnea that wore their masks, their sleep masks, compared to those that didn't. Those that did wear their masks were 3 times less likely to suffer from a non-fatal cardiovascular event, stroke, heart attacks, those sorts of things. And if we want to go the stick approach there, those that didn't wear it were thought 3 times more likely to suffer from one of those conditions or one of those cardiovascular events. And then specifically with stroke, the study looked at people that were using their sleep apnea machine post-stroke, and they actually found that those people had a greater short-term neurological improvement. So if that's not motivation enough to not only go and get that treatment, get your mask if you do have sleep-disturbed breathing, and wear it, then I don't know what is. Well, hopefully I'm going to talk about what is. Okay, take a breath. I'm going to take a bit of water, and we're going to talk about that's the what could be going on from a specific disorder point of view. Now we're going to talk about why am I so passionate about this? Why am I flaunting this so much? Have a think for a second. What do you think? What do you think classifies as insufficient sleep? You can fire an answer at me or a question at me, or throw your answers in the chat box if you like. So you'd be surprised, anything less than 7 hours of sleep per night, there is objective impairments in the brain and body. So we need to be aiming for 8 to 9 hours of sleep every night. Anything less than 7 hours, you are impaired. And we'll talk about how that works in a second. So we're going to look at the magic of sleep and also the dark arts of sleep deprivation. There's a carrot and stick approach here. I'm going to do my best to juggle those because the stick approach is quite confronting, although more attention grabbing. So I'm going to try and juggle those a little bit. Motor learning and neuroplasticity. So 99% of people that I believe I'll be speaking to, that is your goal when you come into our rehab clinic or you do your exercise or your rehab. You want to improve your neuroplasticity and your motor learning. So this study looked at 8 hours of sleep versus less than 6 hours of sleep acutely. They found, first of all, that there is improved visual perceptive learning with those people that got 8 hours sleep. So that's things like looking at street signs, doing puzzles, entering phone numbers. They also found that procedural learning improves. So learning or playing an instrument, using a keyboard, sewing, drawing, all these things we generally need in our day-to-day life. Interestingly, I'll leave that point there. If you come in and you do your 3 hours, 2 hours of rehab in our session, whatever you might be doing, it's most likely going to be focused on neuroplasticity and motor learning. And then you go away and you sleep for 8 hours, you are actually going to be 20 to 30% improved on your skill performance after that sleep than where you left off the practice the day before. So sleep is consolidating that learning and that neuroplasticity. So essentially, practice doesn't make perfect, but practice plus sleep makes perfect. So thinking about your rehab, you're doing your motor upper limb training, potentially gait retraining. If you're a parkie, you're doing your PD Warrior specific exercises. All of this stuff needs sleep to consolidate and download. And so essentially, this is Dang Vu and colleagues summed it up quite well. REM sleep selectively prunes and maintains new synapses in development and learning. So I could probably end the presentation there, and hopefully I will have sold you on the importance of sleep, but I'm going to keep pushing because I want you to really be on board at the end of this presentation. Memory. I'm going to give you another quiz here. So if I was to give you a series of new facts and information to learn, and then you've got the option to stay awake to try and remember those facts and information, or you have the option of sleeping for 8 hours. Which do you think will improve your memory? I think you probably know the answer because I'm leading the witness a little bit here with this presentation. But those that sleep will have a 20 to 40% improvement in memory and learning using that sleep compared to those that stay awake. Compared to, this is again, carrot, now we're on the stick. So those that have 24 hours sleep deprivation have a 40% decrease in ability to learn new facts. So it is seriously impacting on your memory. So essentially what that will, if I unpack that from a functional perspective, a good night's sleep not only prepares your brain for learning, whether it's motor learning or memory, and then a good night's sleep after that improves the ability to download those skills and consolidate those memories. So, I'm moving on. Cool. Fatigue. I would say, again, I'm going to throw random stats at you. 90% of our patients that come in, whether you've got brain injury, Parkinson's, stroke, fatigue is probably going to be one of your main issues. Are you operating at your maximum in your rehab sessions and in your life? And is sleep impacting on this? So this is, again, looking at 8 hours of sleep versus less than 6. Those that had 8 hours sleep improved their endurance by 30%. This is acutely, like day after 8 hours compared to day after less than 6. There's an enormous number. That's due to the lactic acid, the decrease in lactic acid buildup and the increased ability of your lungs to expire cardiovascular CO2. So fatigue is an issue for you. This could be part of the reason why you might be, working your bum off in the exercise programs. You're trying to eat well and all these things. But if you're getting less than 6 hours sleep, you are 30% worse off than someone that got 8 hours sleep. Not convinced yet? I keep going. Concentration and reaction time. So again, giving you a little quiz here. So this study, I'm not sure if you may or may not have used these blaze pods. It's a similar sort of study. They looked at light up pods or light up lights, and you had to quickly react and hit them. So essentially concentration and reaction time. They had a few different groups here. They had 6 nights of 4 hours sleep, 10 nights of 6 hours sleep, and 1 night of total sleep deprivation. Which of these groups do you think resulted in a 400% increase in micro sleeps and lapses in concentration? So a 400% decrease in performance compared to someone that got, I think the control was 10 nights of 7 to 9 hours sleep. Have a think. What are you choosing? 6 nights of 4 hours, 10 nights of 6, 1 night of total sleep deprivation. Guess what? They were all the same. That was a big outcome from this study. I see a few people chatting, so I'll have a look. 6 nights. Jace, you've said 6 nights of 4 hours. Well, you're correct, but also same was 10 nights and 6 hours and 1 night of total sleep deprivation. I've jumbled that up a little bit, and hopefully that makes sense. But all of those conditions resulted in a 400% increase in microsleeps and lapses in concentration. So let me put that into perspective. If you have 10 nights of 6 hours sleep or less, you are as impaired as someone that's had a total night of sleep deprivation. Okay. In this study as well, they also looked at, they asked the participants if they felt like they were impaired by their sleep or sleep deprived. And they all responded, except for those with total sleep deprivation, they all responded they felt fine. They felt like they were operating well. So essentially, you don't know how sleep deprived you are when you are sleep deprived. Functional impacts, obviously balance, falls risk, all these things. And they also found a deterioration in your balance through stabilizer muscle fatigue, strength, and reaction again. So those that are falling or those that are working on your balance, part of the reason could be that you're struggling could be lack of sleep. I realize I'm going over time here, so I'm just going to try to speed things up a little bit. Cognitive function, this is a good one to speed up because we've kind of talked about it. Again, 8 hours sleep versus less than 6 hours sleep. What are the benefits of sleeping well? Decreased cognitive errors, short-term recall and working memory, we've talked about. Improved learning of cognitive tasks, improved creative thinking, which I find quite interesting, improved situational awareness, improved attention-intensive performance, so thinking of those complex tasks, complex exercises you might be doing, and emotional rationality. So we've all felt this, but I'm going to put some stats on it. So if you have 24 hours of sleep deprivation, you have a 60% amplification of emotional reactivity. So if you felt that you're a little bit irritable sometimes and you're snappy, it's not, you're not alone, and it's what the stats are saying, 60% amplification of that emotional reactivity. Couple more to go, and then I'll let you take a breath, and I'll take a breath as well. Weight gain. So if you are trying to lose weight or improve your weight control, poor sleep results in increased appetite, increased caloric intake, and 30 to 40% increased preference of high carb food. So you are hungrier, you're going to eat more, and you're going to eat more of the crap. You're going to eat more of the bad stuff. And again, that was looking at 5 nights of sleep compared to less than 5 hours. That was looking at 5 nights of less than 5 hours of sleep. The mechanisms for that is due to the hormones. So leptin and ghrelin, and no, they're not Lord of the Rings characters. They are the balance that sort of controls our hunger and satisfaction levels. And they're off the charts and out of control when we are sleep deprived. Immune function, obviously a very important topic now, not only in a post-COVID or a COVID world, but especially those living with an autoimmune disease. So this is quite an interesting study. They literally sprayed the common cold virus up people's nose, and they quarantined them, and they looked at how many people got infected. So those that had more than 7 hours of sleep per night in the week prior had an 18% infection rate. Those that had less than 5 hours a night had a 50% infection rate. So you are more likely to get sick after if you are sleep deprived. Simple as that. That means less time in your rehab, less time enjoying your life. Let's get on to our sleep. And sleep, this is quite interesting. Sleep also improves your immune reaction after a flu vaccine. Not sure if it is the same for COVID vaccine. I would imagine so. So whenever you get your vaccine, make sure you get a good sleep the night after, because it can have an impact on how well that works. There's a little bit of darkness before the end of the light, before the light at the end of the tunnel, guys. I'm going to quickly go through this side because it's quite scary. I'm going to look at the chronic effects of sleep deprivation, and I'm going to go through it quickly. I'm not going to talk about the mechanisms too much, but if you're not convinced by the acute quality of life, impact, performance issues that we've talked about, this should scare you enough to prioritize it. So with chronic sleep deprivation, there is an increased risk of developing Alzheimer's disease. So 60% of patients with Alzheimer's have at least one clinical sleep disorder. You have an increased risk of developing cardiovascular disease. That's due to overactive sympathetic nervous system, which is like our fight or flight. So when we're sleep deprived, we're always in this state of fight or flight. That fight or flight chronic state results in high blood pressure and high heart rate, tachycardia and hypertension. And we're also at an increased risk of developing cancer. Nothing fun here, okay? So that, again, is due to that overactive sympathetic nervous system, causes chronic inflammation, and it decreases your M1 cells, which are your cancer fighters. Dwell on that. Take it in. Don't get too scared. Here's the light at the end of the tunnel. So sleep hygiene. You've probably all heard this term before. Sleep hygiene is defined as habits and practices that are conducive to sleeping well on a regular basis. So we've kind of talked about, we have talked about the common sleep disorders that I've focused on and how to treat those specifically. You may not fall into one of those categories. You may not fall into Parkinson's, MS, stroke. Regardless of that, this is the low-hanging fruit, the stuff that you can implement tonight, tomorrow, for the rest of your life that should impact on your sleep positively. Even if you take one of these things and you turn it into a 10% improvement in your sleep, that can have a range of impacts on not only your chronic health, but your acute performance and quality of life as well. So we're going to talk about this. By the way, don't feel like you have to scribble anything down. I'm going to send through, hopefully by the end of this week, a little handout and a little sleep hygiene checklist. So check your emails for that once that's done. So sleep schedule is the most important one, so it gets its own slide. So we want to aim to go to bed and wake up at a consistent time. So set your bedtime reminders and set your wake-up alarm at the same time. There's issues with this, and I should mention, not everyone listening to this may be able to do these things as easily. You may rely on carers to get out of bed or get into bed and those sorts of things. So I understand that, but if you could kind of work with your situation the best you can and implement some of these sleep hygiene tips, you will be better off. So we want to program your circadian rhythm and keep it in tune with you. Some of us are night owls, some of us are early birds. That's fine. Try to work on your 8-hour sleep cycle that works for you. We move on. Exercise, again, beauty, how good. So we know that exercise improves your sleep. We want to avoid exercising any later than 2 to 3 hours before bed. Obviously, heart rate up, adrenaline, all those things. We want to try and avoid exercising too late in the day. We want to look at your environment. So we want to create a dark, cool, gadget-free bedroom. So a decrease in body temperature is actually required to start your sleep. Important or helpful to dim the lights in the lead up to your sleep as well. And you avoid, this is an obvious one, but I know we all have that habit. We want to avoid staring at that screen before you go to bed. Its job is to keep you engaged and keep you on there, and the blue light and all these things. Get rid of it. Have your bedroom as a gadget-free room. Avoid caffeine and alcohol. Fairly straightforward. So caffeine has a half-life of 6 hours. So if you have a cup of coffee at 2 o'clock in the afternoon, at 8 p.m., half of that caffeine is still pulsing through your veins. So you want to try and avoid that if you can. And alcohol is a bit of a common misconception. Some people think, I sleep better after that little nip of whiskey or whatever you might like, glass of wine before bed. You may feel like the quantity of your sleep is the same, but alcohol actually prevents you from slipping into those deeper stages of sleep. So it prevents your REM sleep. Avoid large meals. That can cause indigestion and discomfort there. And then again, medication. So some heart, blood pressure, and asthma medication can disrupt sleep. And we'll talk about your disease-specific medication as well can be impacting it. So if you want to prioritize it, I would speak to your GP. Strategic naps. Naps are good. Don't be afraid of naps. Listen to your body. Daytime naps have been proven beneficial for your memory and cognition. We want to avoid naps after 3 p.m. though. Daytime sunlight exposure. You want to aim for about at least 60 minutes of sunlight exposure in the morning or throughout the day. And you want to start dimming those lights throughout the night. Relaxation techniques, we've talked about that. So that meditation, progressive muscle relaxation can be really easy. Not an easy, but a really nice technique to help you wind down before bed, especially if your issues are more sort of along the lines of that anxiety and somatic anxiety and things like that. Avoid lying in bed awake. So if you've tried to go to bed and 20 minutes have gone by and you're still struggling, get out of bed, sit on the couch, grab a book, spend just time sort of winding back down, get back into bed when you are feeling sleepy, okay? Because we want to associate bed with sleep. We want to make those neural connections and form that habit. We don't want to associate bed with stress and trying to get to bed and all that, which we've all been through before. Okay, where to from here? Hopefully I've ended on a more positive note, and I've gone through quite quickly, so I apologize for that, and hopefully you can watch it back slower if you get the recording. But I had a lot to try to get through in a short amount of time. Where to from here? So if you believe that you do actually have one of those sleep conditions I mentioned, go and see your GP. They may refer you to a sleep clinic or a sleep study, and we can kind of get to the bottom of that. If you'd just like to discuss your sleep hygiene and come up with some strategies as to how you can best implement those things, speak to your lead therapist, your EP or your physio. Or if you feel that your sleep issues are a little bit more complex, they're more to do with your psych issues, discomfort, bed mobility, then I would be urging you to speak to your occupational therapist, because there are countless different ways and products and things like that we can do to help you get into a better position and help your bed mobility. The OTs are experts at that. I take a breath. Conclusion. So sleep disorders are common. And sleep deprivation is common amongst healthy population and neurological conditions especially. Don't underestimate the power of a good night's sleep and the negative impacts of poor sleep. Okay, so this is the why. This is why we want to focus on it. And I want you to prioritize sleep and ask for help. So although it seemed a little bit doom and gloom there for a minute, there are solutions and there are treatments out there. Whether it's sleep hygiene and you are just trying to claw back a little bit of those habits so that you go from 6 hours to 7.5 hours, whatever it is, or if you have one of those sleep disorders, there are solutions and treatments out there. So prioritize it. It is potentially impacting on your quality of life, your performance, and your long-term health. So get on that and prioritize it. And I'll leave you with that. Good laugh and a long sleep, the best two cures for anything. I'd probably agree with that. And now I'll go to questions. I'll take a quick breath before I do so. 8 minutes over. Sorry about that, guys. Anyone that was in a rush. Okay, let me just open these questions up. Emma, had 3 hours sleep last night. Sorry, I hope that hasn't scared you. Prioritize it. Hopefully that has given you some clues as to do it. John, sleep is very broken. It's been like this for years. So let's get to the bottom of that again. Let's speak to your GP or your lead therapist and see if we can, I guess, to start with, like address, and this is for everyone, address that sleep hygiene tonight. Have a look, have a think about those things that we went through. What can you tick off tonight to improve your sleep? Is it just cooling the temperature down? Is it dimming the light before bed? Those sorts of things. It's low-hanging fruits. It's relatively easy to do. Surely if you had 6 hours every night, you'd function better than no sleep every night. That's right. So that was comparing, that one, Naomi, was comparing 6 hours sleep for 5 nights compared to just 1 night of sleep deprivation. So that was where those two things were comparable. If you had 6 or 5 days of total sleep deprivation, you'd be in all sorts. So yeah, that's where those two things compared. Don't watch YouTube before sleep. John, absolutely. Couldn't agree more. Shorts before sleep, YouTube shorts. Yes, that's right. Avoid the screens. Phones, social media, they are designed. There's people smarter than I that are out there and they're trying to keep you looking at your screen. So you're fighting a losing battle if that's your habit, to get to bed and look at your phone. So do something that is not a screen, read, those sorts of things. Lorraine, you said that's your problem, YouTube shorts. Yep. It is a habit and you can get out of it. And the easiest way to do that is to leave your phone or iPad or iPads, if you have two, out of your room and leave it elsewhere. So you make it easy to not fall into that habit. Jace, sometimes I become suddenly alert and do jobs at 10 p.m. That throws off the 8-hour target. Yeah, that's tricky. It's just that kind of progressive muscle relaxation meditation, trying to switch off. We all fall into that habit of thinking, what have I got to do the next day? And then you go, I better go and do that now. I think that's a habit thing. John, what if you have multiple sleep problems because of another underlying medical condition? I know this sounds like a cop-out, but I would speak to your GP or your lead therapist about that. Again, there's low-hanging fruit. There's little things that we can do, but I think addressing the underlying impacts that are impacting on your sleep, or the underlying condition that could be impacting your sleep, would be, your first point of call. Manaha, 1 to 2 breaks at night for a bathroom in 7 hours sleep. Look, that's not too bad, Manaha. You want to try and get it up as much as you can, but if you're managing 7 hours and a couple of, I think it's probably normal to, I don't know what the stats are, it's probably normal to be up 1 or 2 times throughout the night. So that's okay. But I think try and improve it if you can. Try and give yourself more sleep opportunity so that you are accounting for those couple of times where you do have to go get up. Carol Ann, does the actual time matter if you're going to bed at 10 or midnight, as long as you get the 8 hours? No, it doesn't, Carol Ann. As I said before, some of us are night owls that like to stay up later and sleep in later. Some of us are morning people, morning worms. I don't know what the other term is. Everyone has their tendency to fall into one category or another. So trust whatever you feel is natural. So if you're someone that likes to go to bed at midnight and you're able to wake up at 8:30, 9 o'clock in the morning, by all means, go for it, as long as it's consistent. So the consistency, if I summarize my rambling answer there, consistency is the answer. You want to make sure that is the same as often as you can. Awesome. Any other questions, guys? I think I saw another one in the Q&A. Naomi, you popped down the other one. Yeah, do you have any info on brain injury and sleep? Obviously, didn't cover it in too much depth, Naomi, this time. I think mainly because brain injury is so varied. I mean, all conditions I talked about are varied a lot. But I can, if you email me, Naomi, I will send you some links, and I will do a little bit more digging on what the stats are and what the common sleep disorders with brain injury are as well. Very much depends on condition and your specific symptoms or these specific symptoms. John, can you get too much sleep? Interesting question. Short answer, no. I'd rather you get too much than not enough. Look, you kind of have to listen to your body. You know, some people, especially when fatigued, you know, I'm thinking more about our stroke, our MS population. Fatigue and body battery and neuromuscular fatigue is such an issue. So if you feel that you need 10 hours sleep at night or 12 hours, then by all means take it. Or you 10 hours at night and a couple of naps throughout the day. Sleep's restorative, right? So if we're getting more of it, as long as it's not impacting on your quality of life and your productivity and everything else throughout the day, then more is better to a degree. Obviously, we don't want to be sleeping probably 16 hours sleep. Might be a bit much, hard to get much done during your waking hours, but more is better than less, I'll say to that. Naomi, thanks. Good. Okay. Well, I'm only 15 minutes over time. Apologies for that, anyone that did have to run away. And thank you very much for your questions. Hopefully that has been relevant. Some of my answers there were relevant to you. I'll quickly go through references quickly. Not that you're going to catch those, but if you do want to go through and read the recording after, you can have a look. Thank you, Jace. Thank you, Lorraine. Thank you for your comments there. Oh, what have I done? I've stopped sharing. Sorry. I'm out. I've gone over the presentation there. Okay, well, that's it. Sorry about that. Oh, you've seen my nice background probably now. Thanks very much for joining us, guys. As I said, any questions that you have, please email me, jason@archealth.com.au. Hopefully you receive that handout by the end of this week as well. And if you have any questions about upcoming webinars from ARC, you can email arcademy@archealth.com.au. Thank you very much, guys. Have a lovely rest of your day and hope you sleep well tonight. So.